So I guess we'll go ahead and get started. I hope some more people will join us. Like I said, I am going to record this and post it because, it's Thursday at 7:30. My son's going to bed right now, and so I'm sure there's a lot of families in that same situation. So I think what we're talking about tonight is really important, and I think a lot of people will watch it later on. So, just for quick introductions, my name is Amanda Ryder, and I'm president of Raising Oak Cliff. We have a wonderful partnership with Methodist Hospital that's located in our neighborhood, and that's how we're able to bring this conversation to you tonight. A few things that I just wanted to cover before we get started is one thing that Raising Oak Cliff started doing last year, and I've got a lot of positive feedback on it, but it was providing welcome home baskets to families with new babies at home. And we provide fruit from Cox Market, which is also in the neighborhood. Um, Last year, Davis Street Espresso provided coffee beans. And then we throw in some other baby items. We have some board books or some homemade bibs that are contributed. I also just heard that Davis Street Mercantile graciously donated things like pasta and cookies and olive oil and things like that. And then some other information, specifically information from Methodist, and also this really cool pamphlet that we've put together for families on things to do in the neighborhood. What are the parks? What are the pediatricians? Where, what dentist or pediatric dentist are in the neighborhood? So it's really helpful information for new families. So if anyone wants to nominate themselves or someone that they know, um, and pretty much anyone who's had a baby, we're opening it up to the last year, just because we stopped doing this almost a year ago. So our goal is to try and connect you with other families in the neighborhood. Um, I met a couple of families probably 4 years ago, and we've really progressed as families from toddlers until kids going into elementary school. And that's one of the goals of Raising Oak Cliff, is making those connections in the neighborhood so you don't feel like you're doing this all by yourself. That's one of our mission statements is by bringing us together, we can be stronger as a neighborhood, as a community, as an organization. So if you know someone in the neighborhood that has recently had a baby, it's on our website, but also I believe if you email VPROC at gmail.com, that's for Vice President Raising Oak Cliff at gmail.com, we can get you on the list, and we usually make deliveries about once a month. So that's really the only news that I wanted to put out there. We are doing the welcome home baskets, and then as a group, we're talking more about possibly when it gets a little warmer, doing play groups, outside at neighborhood playgrounds. Just because I know people are getting antsy, and as people are getting more shots, they're getting more comfortable about just being outside. So we're talking about that, and possibly a one big event coming up with Methodist. We have still some more work to do on that. And then as a group, normally we would do our big fundraiser called Glow Cliff, and we're talking about what some alternatives might be. Maybe we do something that's a back to school event so people feel more comfortable about being together, but it's still a conversation. So we're still trying to work out the kinks and making sure that everyone feels comfortable. But I don't want to delay this conversation anymore because I think people are excited about the topic. I'm going to hand this over to Laura. She helped organize this conversation, so take it away, Laura.
Thanks, Amanda. Man, yeah, I'm going to Glow Oak Cliff, and we didn't get to have it last year. And the year before, which was 2019, was the first time we sponsored it. But we did get to do the Christmas event with you. That was missed this last Christmas too, even though we had the drive-in.
Yeah.
But yeah, I think I'm one of those people that's just really also itching to go and meet more moms and more, have my son meet more kids. But we'll get there and we'll do it safely, God willing, this year.
Yes.
But anyway, so I'll introduce myself. My name is Laura Muta. I'm the community director for Methodist Dallas Hospital. And I work with Amanda on multiple things and with other groups in the neighborhood too. And we're always open to hearing ideas from the community about what they want to see from as a hospital, whether it's more talks with physicians, whether it's fitness programs, whether it's sponsoring a fun event. It doesn't have to always be health and wellness. We're open to just something that brings us together as a community as much as we can right now. But we're always happy to hear ideas. So if anyone wants to leave Raising Oak Cliff a message on Instagram or Facebook or email through the website, or you can contact me through Amanda. She'll connect us together. She has my email. But other than that, I just want to hand it off to Dr. Kenzie Saltarelli, who will hopefully get on that brochure that Amanda mentioned later on, because she is a pediatrician, and she is also specialized in family medicine, and she's going to be part of a new practice here in Oak Cliff at a new clinic called the Davis Methodist Family Health Center, which will be located next to Oil and Cotton, which is on Davis Street. So Dr. Saltarelli is going to talk to us about screen time right now with our kiddos and how much screen time is okay, when should we be concerned. So all those other things we're probably wondering, so she'll touch on that. So Dr. Saltarelli, thanks for being here, and let us know, what should we be thinking about?
Great. Thanks so much. Okay, so Laura, I really should have checked this earlier while we were just hanging out, but it looks like screen sharing is disabled. So I do have like a PowerPoint and some websites I want to show you guys, which if we can't make it happen, I will just talk.
But she should be able to make you a co-host.
Yes. Let me work on that, Kenzie.
Okay, I'll just start talking. So I'm Kenzie Saltarelli. I work for Methodist Medical Group, and then also at the Golden Cross Academic Clinic across the street from Methodist Dallas Medical Center. So I'm board certified in both adult internal medicine and also board certified pediatrician. I got hired at Methodist both to teach at the Golden Cross Clinic and then also to help open this new clinic in Oak Cliff, which I'm super excited about, especially since I live here. So I'm really looking forward to us getting started there. Unfortunately, you guys have probably noticed the construction over there on Davis and near Tyler. Got a little delayed. There was like a permit issue, I guess. I'm sure that happens every time anyone builds anything ever. And so I think we're looking at like summer 2021 at this point. But we're going to be really ready to get into that space, and I'm, trying to learn the community as much as I can now and the resources in the area and stuff. So it looks like I am now okay to share.
Can you share before you get started anything else about the new clinic? I mean, it's a family practice.
Yes. So it is going to be the two doctors that are going to be working there are me and then Dr. Kyle Oland. So he is also double board certified in internal medicine and pediatrics. And so it's going to be a family health center in the sense that we will take care of all ages. But it's just a little different just because we are both also like board certified pediatricians, and we've had a little bit more training and exposure with like kids with medical problems and a little extra training in pediatrics compared to maybe family medicine doctors. And then, so when we first get it, this is also like, we're a little far off. So I can't really say the super specifics of all the services maybe that we'll have available and all those things, but those are kind of the two physicians. And the idea is that we'll be able to really take care of like whole families in Oak Cliff, babies all the way up through older adults, and then kind of connect people with, it's so close to the Methodist Dallas Medical Center, kind of taking advantage of those resources and everything as well. So yeah, and my understanding is the building that it's going to be in is also going to have, several other like retail spaces and stuff. So I think it'll be an exciting kind of addition to that growing West Davis Street area. I think they're calling it Typo, like Tyler and Oak or something.
You got it.
Yeah.
You're learning. Welcome to the
Yeah.
neighborhood.
Yeah, did you guys see they put up a sign that says typo on the corner?
I know, it's a cool sign. I really like it. Yeah.
Kenzie, they're going to open that up hopefully in the summer.
Mm-hmm. That's the last update that we got. It's summer 2021. Mm-hmm.
Well, I'm really looking forward to this conversation. Me personally, I've kept my son home to do virtual schooling. So not only is he doing screen time for school, but he's also gets his own personal screen time. And so, especially after that New York Times story that I read this week, I'm a little concerned about what screen time means for little kids.
Yeah, I really hope to that people leave this conversation less worried about it. Not in the sense that like it's not important to think about. It is, but there's flexibility in how you deal with this, I think. And fortunately, like a lot of the recommendations actually got updated before the pandemic, and they're really relevant and helpful, I think. So hopefully you'll feel a little more empowered to figure out what to do about this, and a little less scared of screen time, and a little we can have a little better understanding of like what is negative about screen time and what might be positive about it, and how to use it to your advantage. So if you guys have questions, please interrupt me. I think I'll be able to see the chat pop up here, but just talk over me, because I would really like to hear from you all and what will be helpful for you. So yeah, this is me, just to introduce myself. I live in Oak Cliff. So just so that you guys know who you're taking advice from. I went to school at Vanderbilt, met my husband there. We went up and couples matched at Indiana University. So we moved here from Indianapolis. My husband is from Dallas, so that's how we ended up here. And then coincidentally, like part of my family's here too. So we are here to stay. Right now, while I'm waiting for the Davis Street location to open, I am seeing kids and adults up at Park City's clinic on Lovers Lane, and then also seeing adults at Golden Cross. And we're going to open actually, hopefully, an adolescent clinic at Golden Cross as well. So objectives of the talk today, I want to talk to you about the current American Academy of Pediatrics, or AAP, you might see that acronym throughout the talk, screen time and media usage recommendations. And as I kind of mentioned, I want to focus on why these are the recommendations and then how to implement them in your family, and less so about like how many minutes per day should we be on our screens. And then empower you to develop your family's own plan, especially given the circumstances we find ourselves in. So what I used to tell parents, and like this, I would have this moment with parents where like their kid is sitting in my office on an iPad, which is fine. I think that's probably a good time to have your kid on an iPad when they're having to like wait at the doctor's office. And I'm telling the parent, okay, less than 2 years of age, you're really not supposed to be on screens, and then 2 years and older, limit to 2 hours per day. And we're both just sitting there thinking like, that's not going to happen. We're like, yeah. And then that was kind of like what we felt like we had to say, or what I felt like I had to say. And so in preparing for this talk, really even, I feel like I have a lot more to say about this, and we're going to have to come up with a more creative and flexible way to think about this. And the AAP actually has helped us do that. So the updated recommendations are much more nuanced, and they use some terminology like help you become your child's media mentor. And it's really about balancing your screen time with other activities. So like really just thinking about when you're on your screen, what are you sacrificing? And not so much like what's so terrible about the screen itself, but like what are you not doing because you're on your screen? And then making a plan. And there's a really specific actually tool that I'll show you guys to help make your family media plan that I think is really great. I hope some of you will actually use it, and it'll help you. So I'm going to talk a little bit about pros and cons by age group. And I think there's a bit of a spread here, and then some of you that have little kids, maybe you'll have another later, so you can think about what you might do with a less than 2-year-old. So as you'll notice, like as I go through the age groups, the pros column gets actually a little bit longer as kids get older, and then the cons column, to be honest, also gets longer as kids get older. But like there's more I think that kids can get out of screen time as they get older, whereas less than 2 years old, really, video chatting with family is the one kind of like exception that they came out and made. And I think that's super relevant. I mean, especially now, a lot of kids that are really far from family and not able to see their grandparents or bond with distant family, I think that that should be encouraged. Like, I don't think that there's a reason to be discouraging a little kid from talking to grandma on FaceTime. I think there's a really big difference, and I'll talk a little bit about some of the studies between talking to an interactive adult on a screen rather than like watching a movie. Like, those things really are different, and you don't need to treat the screen time all as one thing, that it's like all bad in little kids. And then I also want to talk, so when I have vague memories from when I was maybe a kid that this Baby Einstein thing came out. So I think that was the original kind of like, it was a Disney program that it was this thought and this advertising strategy that like your kid can learn words from these fun videos. And back then the technology wasn't such that there could be touch screens and interactive like pieces of it. So it was just like literally just videos. And that actually resulted in several lawsuits, just because of like the false advertising, and the data didn't show that little kids can learn words from videos. There's since been some data that like maybe at 15 months and older, kids can learn words from videos, but much better if they are watching a video with an adult who is there with them and reteaches the material and interacts with them about it. So like the best way that kids learn words is from an in-person adult. The second best way is actually a virtual adult, but that is interactive with them. So like an actual video chat. So like your kids that are in virtual school, I mean, obviously kids less than 2 years old are not doing that, but like that is different than just watching a movie. So then less than 2 years of age, there are several cons to think about. So there is some evidence actually that there's possibly a language delay even associated with programming. And specifically, like they studied there, a couple programs that honestly the American Academy of Pediatrics seems to be pretty pro. Like it makes you wonder a little bit if there's some money changing hands, but they really like Sesame Street and PBS and Common Sense Media. But even when they studied those programs, those educational programs in kids that are really, really young, there were like 4 studies about it, and 2 of them showed that actually might cause a language delay to sit your kid in front of the TV, and then 2 of them were like maybe no difference. And then obviously the con in every age group that I'm going to tell you about is decreased active time. So kids that are less than 2 years old are supposed to be active for 180 minutes a day. Which most of them are, like left to their own devices, that's really not a hard number to hit. Like kids just like run around like crazy. But if you sit them in front of a screen, they won't. So you have to really think about like how much time is my kid sitting because of this. And there are screen time activities, we'll talk about them a little bit later, not so much for this age group, that are like active. You can do, I forget that lady's name who does the
cosmic yoga.
My niece and nephew like love that, and it's great. Like I don't think there's anything negative about that, for them to be using their screen to do a yoga activity like with me. They're interacting with adults and being active. So then brings me to my next con, which is decreased interactive time with family. So definitely like that's going to have a negative effect on your kids, and it's been studied that if they're spending time on the screen, that's time they're not spending building their relationship with you, building their relationship with their siblings, with their friends. And then decreased sleep is a big one too. And this one's interesting because like infants don't really watch TV. They just don't, they can't do it. But the blue light even affects them to the point that they sleep less if there's a TV in the bedroom with them, or if they're exposed to a lot of blue light. And then of course the older kids will be really affected by that too. So 2 to 5 years of age, there are going to be some overlap here. They can learn words better as they get older from screens, more so with interactive. So there have been some studies on some games that the games aren't commercially available, but like the concept you guys can kind of look for when you're looking for apps for your kids to play with, that like they really need to be interactive. Like the kid has to do something that has to do with the word, not just like pushing buttons and making noises and stuff, but like something that really is like requires them to understand and respond. And you want to be careful too that it's not just a bunch of distractions, like just colorism, lights, and things. And so there is like some evidence in this age group that they can improve their literacy, social, and cognitive skills from well-designed programs. And specifically, a lot of the studies have showed Sesame Street, PBS, to be those well-designed programs. Similar cons: decreased interaction with family. So these games are typically not going to help kids learn creative and flexible thinking. There's obviously like a task at hand in the app, and it's not going to be able to just like create a fantasy world that, you know, like you can when you're doing imaginary play and all those things. And then it doesn't really help with impulse control either. I had an experience where I brought my nephew a Happy Meal kind of thing, and it had like a little toy in it that he was supposed to like build. It was like little foam rubber, and you're supposed to put the little pieces together and build it. And he spends a lot of time on the screen. Great kid, but a lot of time on the screen. And I just really noticed like how frustrated he was that the pieces didn't just fit together just because he put them near each other. And so I just feel like when the kids are using the apps give you a lot of leeway to kind of like push, make things kind of just like work the way that the app lets them work, if that makes sense. And it doesn't always translate to real life, and really learning to build and create and control your impulses, all those things, those are really best learned through real life play and adult interaction. And then this is also, as kids get older, there's much more data about BMI increases. So there's actually been a study that for every hour per week of time kids spend using media, their BMI, which is their weight for height measurement, increases. So we are seeing that this has a negative effect on physical health for kids, and then again decreased. So 6 to 12 years of age start to get into this pro category of like that kids can actually be exposed to new ideas, new people, social support online, and then in theory access health promotion information if they're directed kind of in the right way. So they've actually shown, like some kids will say that their online friends are more supportive than their in-person friends. There's like, you know, a little bit of a connection that can happen there that maybe is even deeper sometimes than in person. So I think there can be pros there. Now, the flip side of that, which we'll talk about in a little bit too, is like the bullying can be easier online. So there are definitely more negative social interactions that can happen online as well. Another thing is like kids that are maybe less mainstream, like they maybe have interests that don't align with like a lot of the kids that they meet at school, or even kids that have like what I've seen in my training a lot is kids that have chronic illnesses. They can connect with people online that they wouldn't have met in person, or if they did meet them in person, they might not have known this about them. So there's a lot of like amazing things that can happen for kids on the internet. But then back to our cons column, this age is also where you get into like, your safety concerns. So the kids are able at this point now to like actually post information online, interact with people that they really don't know. So it becomes more important at this point to be monitoring your kids' online activity and thinking about those things. And then misinformation, which is like we're all susceptible to that. This starts, around this age and then continues throughout, that this is like a huge con of having access to information on the internet. Decreased sleep, I'm a broken record about that, but it's really true. And then decreased activity levels again, and privacy concerns, which is similar to safety concerns, but really more just like if you post something on social media, like that lack of understanding when kids are really young of like how difficult that is to unpost or take back, and what the consequences can be there. Adolescence, similar, like it's just kind of a continuation of these things that I've talked about in the earlier age group, like that they have opportunities for increased social contact and sometimes more specific supports for like different aspects of their personalities and lives. Education can be improved by access to screens and the internet. And then adolescents are able to take in current event information in ways that definitely I wasn't able to when I was an adolescent. Like they can look for their own news and form their own opinions and see what other people are thinking. So I think that like we shouldn't throw the baby out with the bathwater in terms of what the media can do for your teens. But then it's complicated, more and more complicated as they get older. So there's been some evidence that when kids are exposed online to these things, that it leads to earlier initiation of tobacco, alcohol use, and sexual behavior. Bullying is a massive issue. And we'll talk a little bit about how to talk to your kids about that in a minute. Mental health. This one's interesting. So they did a study that basically showed that social media can have a negative effect on your life satisfaction, but only if you are a passive participant. So if you're somebody who's just scrolling, like looking at pictures of other people's lives, just observing, that will decrease your life satisfaction. However, people that actually post and interact and use it to connect, they will have, I don't want to say increased life satisfaction because that's not what the study showed, but it didn't show that decrease in life satisfaction of people that don't use the social media, that just kind of take it in. Privacy and safety get even more difficult in this age group. There was one study that showed that 12% of kids 10 to 19 years old have sent a sexual picture to someone. So that's a lot of kids, and that's a really serious thing that cannot be undone. So definitely need to be talking to kids about the consequences of stuff like that, privacy, safety, all that. And then all the same things as before: sleep, decreased activity level, decreased family connection with too much screen time. And then some additional thoughts on screen time. Parent media usage is a very strong predictor of child media usage. So just like everything, like healthy eating, exercise, all this stuff, it's really going to be difficult for us to tell kids, don't do this, you can only use your screen this much, or you shouldn't be that interested in your screen, you should be doing these other activities if we're not doing those things. So just some food for thought. TV in the bedroom. So I really do try not to make a ton of super strict recommendations to families because every family's different and everybody has a different perspective. I would really encourage you, if you have TVs in your kids' bedroom, why you have those. If there's just like not a lot of good that comes out of that, really, really bad for sleep. And yeah, a lot of the studies are just like, please don't have TV in your kids' bedroom. I'm sure some family has like a really good reason for doing it, and that may work for your family, but really think about that one. And then I also want to talk about internet gaming disorder. So this is a real thing that is becoming more and more prevalent. It's essentially notes about this, but I'm not seeing them right now, what the diagnostic criteria are, but basically kids will get so addicted to internet gaming that they have like decreased interest in real life activities, and decreased, like, they just don't really care as much what is going on in their real life because the gaming is what's the priority. Withdrawal symptoms like irritability when they can't play, and just like a complete preoccupation with it. And this is something that we actually have to deal with. So just wanted to throw that out there, that is now a recognized like psychiatric diagnosis for kids and adults. Okay, so I might have to stop sharing my screen and then pull up, this. So this is the resource that I'm very excited to show you guys because, healthychildren.org is affiliated with the American Academy for Pediatrics, and they basically made, to kind of replace those old guidelines I was talking about where we were all just kind of like, okay, 2 hours only, and didn't really like give anybody any think this is a really fantastic tool. Like my husband and I are going to do this just for ourselves because I think it really walks you through how to think about what your specific rules in your house are and your goals of your screen time restrictions. So this is a fake child. We're going to do one that's 18 to 24 months, and then we'll do an older one just to show you the difference. But basically, this site will help you create a comprehensive plan for your family. And you can do you can add all your kiddos. You guys can see this, right?
Yes.
So the first kind of, and a lot of these recommendations that I just talked to you about are embedded in this. So like this is kind of a summary of a lot of the stuff that we've talked about. But so screen-free zones, I think this is a really important concept because it's not easy to do, but it's very simple to do. Like you can make a simple rule doesn't have a lot of like contingencies in it. So specifically for an 18 to 24-month-old, but this is a similar thing. Like I won't make a recommendation across the board, but really think about where your kids' devices are charging at night, even your teenagers. Is it really necessary for them to have access to their phone while they're supposed to be sleeping? If they wake up at 2, I'm on my adult patients too, but like my teenage patients, anytime people are like, oh, I can't sleep, I'm like, what do you do when you can't sleep? And the answer is like almost always that they're on their phone. And that is, I mean, me too. And like as an adult, it's a little bit, you tell yourself like, oh, I need to have my phone by my bed for like safety reasons, or like what if somebody needs something, but like most of the time you're probably just scrolling through stuff while you can't sleep, or staying up later than you would otherwise because of both that blue light and then also just the stimulation of the content that you're looking at. So think about where your kids' devices are charging, but there's absolutely no reason that an 18 to 24-month-old should have a device charging in their room overnight. And then I think probably dining room table is going to be one that would apply to a lot of families. Like really not a need for a kid to have a device or an adult to have a device at the dining room table. And then in this like family media plan, you can type your own. So if you have another space in your home that you want to make a screen-free zone, you can add it in there. And again, you don't have to check this. Like if you're like, well, at our house we need to have a screen at the dining room table for whatever reason, then you just don't check that, and you just want to think about why you're doing that. Let's see, and then this one I think can get it's not quite as clear, but some things to think about. So maybe your family doesn't use screens in the car. A lot of like good conversation happens when people are not looking straight at each other, like if you're going on a walk with someone or driving in the car. So that can be a really good time to talk to your kids about stuff that might be hard to talk to them about when you're like staring at them face to face. So just think about if screens are getting in the way of that. And then family time, this one's a little vague, but you guys will maybe in some of your families that's a term that gets used, that this is family time and this is not when you use screens. Meal times, I didn't mention this one, but there are tons of studies on weight gain associated with watching TV, period, but especially during meal times, because people are just like distracted. You're not thinking about whether or not you're full. And then also interestingly, the advertising of food really actually affects your hunger and your satiety kind of cues. An hour before bed, this is aspirational. We should all not be using devices, screens, an hour before bed. I am super guilty of this. At least turn the brightness on screens down, and then at least, especially now we're talking about an 18 to 24-month-old, there should not be intense or scary things that are played in the evening. Other screen-free zones, maybe stroller. I think most little kids are I don't want to speak for all of your little kids, but most little kids are pretty happy in the stroller. Like there's stuff to look at. They like the motion of it. They probably don't need that extra screen to keep them entertained, but maybe they do. And then let's see, plan for where your device curfews. So like what time does the device go to bed? Where does it go? And then this is more about like the positive aspects of screen time. So like when you are going to use an app, which one is it going to be? And I think healthychildren.org probably has some specific app recommendations. But what I wanted to talk to you guys more about, rather than like suggesting a specific app, is what kind of app you're looking for. So something that is interactive and should require more than just like kind of swiping around. So co-viewing and co-playing can really, really increase what your kids get out of these apps. I mean, in terms of like the word learning and the things that they learn from it, and then also in terms of just the connection that you have with your child, as much as you can be doing things with them, even if it involves a screen. That's different than them just being kind of plopped down in front of a screen. And then when we have screen time, we will watch educational shows. There's suggestions here. We'll not spend lots of time with fast-paced apps with lots of bells and whistles. Those are really not helpful for kids learning impulse control. We'll use our media to connect to others, not using media as a babysitter, but that's also aspirational, I'm sure. But just think about just be mindful of when you're using it as a babysitter. Don't like talk yourself into thinking that you're using it to teach them something when really you're using it as a babysitter, and just know that that's what you're doing, and limit the amount of time that you do that. And then let's see, limit background media. So yeah, as much as like if a kid is doing something else, there doesn't also need to be cartoons on in the background to keep them entertained. You want to try to get them focused on the other task if they're doing the task. And then this is about like, what are we going to do instead? So there are some ideas here: playing outside, playing dress up, playing with friends, Legos, puzzles, being with your family. And we'll talk a little more about alternatives later. Manners, this is not relevant in this age group. We'll talk about that when we do an adolescent one. This one I don't think is relevant either. I don't really know why this is on the 18 to 24. I don't know how they would give out personal information online except by accident, which I'm sure has happened. An hour before bedtime and then get 11 to 14 hours of sleep. So if you click all these boxes and then you can type in all your own, it'll help you get to a point where you can print your media plan for that child. So we'll go through an adolescent one just to show you the differences, but it won't take as long because there's some overlap still. So we talked about where devices charge. That'd be just something to think about for your teenagers. And then screen-free places. So this adds a few other interesting screen-free places. So walking across the street, and you really do have to tell your kids that. Like, I think some kids, especially in my experience as taking care of adolescents, there are some adolescents, and really a lot of adolescents, who trick you into thinking that they're super mature. Like they are, they're really smart, they speak really well, like they're thoughtful, they're interesting, they just don't have good impulse control. And they really do need to be talked to about using your device when you cross the street, using your device while you're driving. So don't get tricked into thinking your wonderful teenager, who I'm sure is really wonderful, doesn't need to be told these things. So these are very similar: family time, meal times, device curfews, where they're going to charge. And then same thing, I mean, co-viewing and co-playing are still better in adolescents than just letting them go off on their own, scrolling through Facebook or whatever. And then things that we can do with our screens that are positive. So playing learning apps. I don't really have great suggestions off the top of my head for adolescent learning apps, but I could look into that and get back to you guys if anyone's interested. Video chatting, playing creative apps, watching engaging appropriate educational shows, not visiting new websites or video sites without asking permission. That probably will get cumbersome at some point with an adolescent, but just something to think about. Use media to be creative. So, I mean, if your kid is using the screen to learn to code, I think that's fantastic. You have to still think about, like, are they also getting enough exercise? Are they also interacting with family? Are they also socially engaged? But I don't think that necessarily your kid having a hobby that involves a screen is evil. Use it to connect to others, educational stuff, balancing online and offline. So this is if you have a teenager, they're going to have to be much more involved in this process of creating what they want to do instead of screen time, because they're going to have a lot of opinions and things that they are and aren't interested in. Manners. So this one applies to adults for sure, but trying to create a culture in your home of not texting while you're talking to someone, not interrupting a conversation because you got an email. I mean, we absolutely struggle with this in my house too. Not keeping your phone under the table at meals and things culture of like, if you really are expecting a text or a call, like if I had that happen in my office, if I am seeing a patient and I think I might get a call later, I'll tell the patient at the beginning of the interaction, like, hey, I have this situation going on and I'm expecting that I might get a call. If that happens, I am so sorry. I'll try to keep it brief and be back in. You can do that with your family too. Let them know that you think someone might be calling you, or you're expecting someone to text you back about something, so that it's less like hurtful and jarring when it happens if you've kind of warned them that there's a real reason and that it's important. Digital citizenship. So it's super important to be talking to your kids about online bullying and sticking up for others. I mean, it's just so easy to bully online. You can be anonymous. This is just absolutely rampant, and obviously, you might not be, as a parent, maybe you are, but maybe you're not reading every single thing that goes on in their text messages or their Facebook and everything, but just really talking to them about how serious it is to be bullying someone online, what that feels like, trying to help them understand from both perspectives, have empathy for it, and then also creating space for them to tell you if they're being bullied online. This age group is when it gets more relevant that you need to talk to them about giving out personal information online, and then some of these safety things that we already talked about. And then these are some specific recommendations on sleep and exercise. So kids and adults need 1 hour, 60 minutes of exercise a day, and then 3 times a week. That should be, in theory, like rigorous or muscle building is the recommendation. So just making sure that screens aren't taking over all of the time that should be spent doing things like that. So that's pretty much. Let me now switch back over. I think I had a couple more slides. The other thing I wanted to touch on that I think I forgot is I didn't come across, I thought I was going to see a little bit more in kind of researching this, stuff about like eyes. I think people worry a lot about their kids' eyes, that they're staring at screens too much, it's going to be bad for their visual development. I don't think that's really been like borne out in the data. So I wouldn't worry, like with now that your kids are in online school and they're having to stare at a screen all day. I think I do have patients that I think it bothers it gives them headaches and bothers their eyes. Absolutely. I do see individual kids that happens to, but if it doesn't bother your kid, hopefully I don't regret saying this in like 10 years when they realize that this is wrong. But like, I don't have any known reason that you should worry about your kids' like visual development or their like headaches or things that come from staring at the screen too much. I think it's more helpful, or in the data that we have points towards really thinking about like what are they doing with their screens, and then what is that time taking away from otherwise, and not so much that like they're not going to develop their vision normally if they stare at the screen too much. So alternatives. Okay. So I don't want to like get too into super specific activities, and I did want to hear from all of you if you have any things that are working for your families right now, especially for like things you can do instead of screens. I just want to emphasize like using screens in ways that kind of mitigate some of these things. So you can use screens for exercise. Like I remember when I was a kid, I used to do like choreography videos, like they have, and I'm sure these are all over YouTube, like they'll teach kids how to do a dance on a screen. I wouldn't count that as like negative screen time. Oh my gosh, my kid is watching TV. Like they're dancing, they're doing a video. They can do it with someone else in the family, with a friend, or maybe not right now, but hopefully soon. Let's see, what else? I think books on tape also can, and especially in older kids, can be a little bit different than screens. I don't think you should like expect a book on tape to teach your kid words when they're really little, but I do think that books on tape leave more room for like imagining a scene yourself, having to fill in some of the blanks and things in a way that watching a movie doesn't. It's a little bit more cognitively interactive. And then the other thing I'll say about alternatives is just like you got to have a whole I'm sure, like, super long list of ideas. Like, I would recommend even, like, writing down all of your ideas for alternatives for when your kid says they're bored. There's a ton of, if you Google really, but like on Pinterest, tons of blog posts that people have written of like screen time alternatives, and just like endless craft ideas, and then like the basic stuff like go for a walk. Like, you don't really need me to tell you that, but like just having it written down for like in those moments when you're like, we need something else to do. My kid is bored. My kid has been watching TV for too long. Okay, let me just look at this list, see if anything on here seems practical right now, if we have the supplies to do it. I think probably having a written list can go a long way to like help you prepare ahead of time for when the moment comes when you need an activity. So I think I've like said this a lot, but basically what I'm saying is there are pros and cons. And I hope now you understand the specific cons a little bit more so that you can help make a plan that has more pros than cons in it. I'm not recommending that you focus on the number of minutes per day that your kid is on their screen, but more focus on the number of minutes per day that they're doing other things and what screen time is crowding out, and then what they're doing on their screen. And I really recommend that you at least look at, if not use and print out, the healthychildren.org media plan for your family. And I would say make one for like every single member of the family, even the parents, because it really does take like everybody in the household to be paying attention to this and trying to do a better job to make a difference for your kiddos. So I think that's all I got. So I'd love to hear, questions, but also just like thoughts or struggles from your families or things that have and haven't worked for you. So I will stop talking now, finally.
Well, I do want to share that the one thing that has really worked for us, you sort of talked about making a family media plan, and back when all of this started in March, we were kind of forced to come up with okay, what are we going to do every day? And so we made sort of a daily plan. And so wake up, we do this, we do school, we take a break, we go for a walk. And the one thing that's really worked for us is when my son's done with his day, he gets 1 hour on whatever device he chooses. So it could be the iPad, it could be this, it could be that. And we set a timer. And it's actually really worked. And it's just like, okay, when the timer goes off, then you're done. And instead of just like letting them play until, whenever, 4 hours later, that has really helped us, setting a timer.
That makes sense, because then he doesn't have to be like begging for it at other times. Like, he knows when he's going to get it. Mm-hmm. He knows when he's not going to get it. Yeah, that's a great suggestion.
So this is me not talking as doctor, but me talking as mom. And I will say that you've already made me feel a whole lot better about what we do and what our kids do than when we started this conversation, because I think they do a lot of really creative things online that are not just absorbing what's going on. My kids are a little older. They're 14 and 10. And so a lot of, we started with a process called, I'll just tell you some things that have worked for us, 24/6, which means that there is a 24-hour period every week where we are not on our devices. I will tell you that out of the four of my family, I am the one that fails that most often. And I use work as an excuse to fail that a lot of time. So I do need to be better at being a better example, but everybody has really kind of bought into that 24/6 plan. I think we're going to use that tool that you showed us to kind of morph the 24/6 into that, and also say, hey, in addition to that, these are the specific times that you don't need to be on your device. But I will tell you that there's some really fantastic stuff out there that they do creatively, both at school and otherwise. We have a Nintendo Switch, and there's this game called Ring Fit that is a serious workout. And my kids will do that way more than they'll get out and go for a run. And getting that exercise with that, I think, is a fantastic thing, too. So I'm glad to hear that there's some good, because We're on it a bit. Yeah.
The other thing is that I did talk to my son. I told him that we were going to have this conversation, and again, he's 6, but he did say, he mentioned that sometimes his eyes do hurt, and that's when we know it's time to take a break. But when all the kids started going back to school in September, there was a lot of people talking about buying the glasses that sort of like they don't ingest is not the right word, but like it sort of the blue light, it takes away from that blue light. And I didn't know if there's anything to that, or that's just like someone said, oh, I'm gonna make this, and then they made $1 bajillion because someone said it works.
Yeah, I mean, I have a pair of them. I'm not going to like make fun of anyone who bought them, but I think it's nonsense. But time will tell. I'll try to look more specifically into that and let you know if I see anything. I don't think definitely if I had a patient come in, which I have had adolescents come in lately, especially and be having headaches from staring at their screen. It absolutely happens. I don't know that I would say try some blue light glasses at this point. But maybe I should be saying that.
Kenzie, do you think posture has something to do with it too? Maybe thinking of how to properly, how to sit properly for your lessons.
I didn't think about that at all, because when you're in a classroom, you're moving around a little bit more, looking around, and you can get stuck in the same position. Yeah, that's a really good point. Actually, I don't know anything about that, and also how far away from you should the screen be, stuff like that. That'd be something good to look into.
Hey, Victoria, did you have any specific questions that you wanted to ask?
Could you share the link for that Healthy Children?
Can you put it in the chat?
Yes.
Yes.
Yeah. So I wanted my daughter, as soon as I found out I was pregnant, I was like, okay, she's going to do biological classes. And, that's complicated because of COVID. And we went ahead and signed her up with social distancing classes. And after the first class, we got a notice saying that there was a parent that had it. And so we decided to not do it right now. But the dance classes through video on YouTube have been a saving grace. So I'm glad that you guys referenced that, because it's been a way for me to it feels like there's a lot being missed. So it was good for me to get to see we can still do this. There are other ways and things that you can do that. So,
yeah. I really don't think the screen itself is necessarily the problem. For some kids, like I said, it will hurt their eyes or give them a headache. It's more just what being on the screen all the time does to how sedentary you are and what you're not doing instead. And that's really where the AAP's recommendations come from. That's where the data is. It's not, so I don't have any reason to think that a dance class online would be a bad thing. That sounds like a really good thing.
Maybe one thing that I can do online is really try to ask for recommendations for what other families are doing in terms of more educational type apps or TV shows. I know that one thing that I liked for my son is there's a Scholastic app, and it's a game, but you also learn about what types of books that they have and the characters, and so you're sort of gaining their interest in what types of books there are and learning the characters with a little bit of fun mixed in, so that when you do go to read Dogman or whatever other Scholastic books, it's like, oh, they see them and then they're a little bit more engaged in the books themselves. And Dr. Patton is suggesting Cool Math Games as a good website.
Hey, Kenzie, I had another thought, about my son is only 4, so he's in preschool, but other kids, other parents have kids Cliff parents have kids that are in elementary school. Elliot's in 1st grade.
He's in kindergarten.
But we'll be going on to 1st grade. And I was curious, what if my son was older, and would I be concerned that he's not going to be able to learn math or learn whatever, other course material because it's online, but all the stuff you showed us suggests that video learning is efficient, that it and that we really, what I got out of it is that we really should just think about the what else is missing or what we're not doing when we're doing screen time, taking away more active time, playtime, other stuff, and just be more concerned about that. But data hasn't shown that it will damage your eyes if you're little and on the screen a lot. So far, I get that it's so far.
But there haven't been kids that have been on the screen this much yet. So it's like,
on that, I was wondering, about homeschooled kids, whether they, in their learning before the pandemic, looked at a lot more screens compared to kids that go to regular school. And I wonder if anyone ever did a study there, like, compare those two school and regular school kids to give us some idea of whether learning through screens is how does it affect me? I don't know.
I think it's different from kid to kid too. Like one thing that's definitely been happening, I take care of certainly kids with ADHD, but I also have adults that have ADHD because you actually don't grow out of ADHD. Fun fact, you just develop coping skills. So like a lot of adults that had bad ADHD that needed meds as kids, as an adult, they maybe have learned strategies, but they probably still have ADHD. My kids, my adolescents and adults that are in online school are struggling. The ADHD population definitely struggles with like being in, having to be at home where there's distractions and staring at the screen. Like that's been hard. So I think it probably is a little bit like kid to kid dependent. But I think that there's hope that like online learning can work for your kids, and that if you stay engaged, that can help them, and that watching a movie and having your teacher talk to you on Zoom are two very, very, very different things. So I think it probably can work for a lot of kids, but I will say I think there are some people that are going to struggle with it.
I do like what you said too about the audiobooks and keeping the phone out of the room at night. So we did have a really strict rule about keeping the phone out and charging it in a different room. The problem was that it was hard for her to kind of settle down, and it seemed like audiobooks really helped her mind kind of settle down at night. And the really beautiful thing about most phones is you can shut down the phone at a certain time. So they literally cannot do anything except for the apps that you let through. And so we would let just the audiobook kind of app work, and everything else she can't pick it up in the middle of the night and look at it because she doesn't know the code.
That's awesome. I didn't know that. Yeah, I'll also say I do. Oh my gosh, in my time as a pediatrician, I have heard a lot of parents tell me, and I feel for them, but like, oh, I try to hide the phone, but they find it, or I try to use these features, but like, if your kid doesn't know the code, they don't know the code. So I think that's awesome to know that you can do that, and just kind of like I'm sure none of you all are thinking this way, but I do have parents that are kind of making excuses, I think, for that they're not able to control their kids' screen time, and just like remind yourself that like you are an adult and you can absolutely control your kids' screen time. It's challenging. Like I'm not saying it's not challenging. It creates conflict, and especially, I really feel for families that are trying to make a change, and that's what the New York Times article